Hi, this is Navya. Under this pharmacology syllabus, I have already discussed from chapter 1 till chapter 13, and also I have uploaded in the playlist. If you're not watched yet, I'll just drop a link in the description box of all these 13 chapters so that you can watch in the later section. And in this video, I'll be taking a class for the chapter 14th, that is the drug use and the precautions. So let's start the class. Chapter 14, that is the drugs use and precautions. In this chapter, we'll be knowing the drug usage in the sense the dosage and the precautions to use the drug, and also we are going to discuss on the renal failure and the hepatic failure patients, uh, what they had supposed to use the drug and what are the precautions they had to taken this for this type of failure, like renal failure or the hepatic failure. So let's start from from the first question, that is the meaning of the drugs use and the precautions. So first let us know the drug usage meaning and the precautions. What are the precautions we have to be taken before consuming the drug? Yes. Yeah, the drug use. So we know that there are certain types of drug. There are different types of drugs. Those are used for different medications. So not only single medications, there are so many medications. They can be used for the different purpose, different medications. So now, uh, sometimes that may be create a problem, that is the different type of drugs, those are particularly the problematic. So that includes uh, Antihisti- antihistamines. So that may include the problematic drug. One of the example, one of the name is the antihistamines. This antihistamines, this is normally it contains like this is used for the treatment of the like to treat the cough or the cold remedies, any allergy drugs like any allergic issues and the motion sickness drugs and the sleep aids. This is in the form of these type of drugs we used to get the sickness drug or the sleep aids in the form of antihistamines. And there is a non-steroidal anti-inflammatory drug also available. These are the like certain types of drug will be available. This anti-inflammatory drug, this is a non-steroidal anti-inflammatory drug. This should not be used during the last 3 months, and this comes under the precaution measures, precaution measures. Because this is a usage and this is a precaution measures unless it's specified by the doctor. If the without the prescription of the doctor, the patient should not consume if the patient is in the like if the patient is 3 months off in a pregnancy condition, because it may cause a problem. That is what the precautions here it is mentioned. Otherwise it may be the problem in the fetus uh, or the complications during the delivery also. These are the precautions to be followed by the patient from the before taking this medication, any medication. And the next question is that explain in the renal failure condition with the treatment and the precaution. So the renal failure and what are the treatment we have to be taken and what are the precautionary measures should be taken. So first let us know the patients. If the patients who all are suffering with the renal failure or any insufficiency, then they should undergo a prophylactic hydration. They has to undergo the prophylactic hydration before they are given any radiological contrast media that contain the iodine. They has to go to the prophylactic hydration. And the most important drugs whose used in the patients with a renal failure or the suffocation or insufficiency are So they has to plan to offer the topic that is the uh, dialesia, that is for the diagnosis purpose and for the treatment purpose and for the prevention purpose. This is that dialesia. And other commonly used drugs also here we have listed, that is diuretics. Yeah, that is diuretics. And we have other medications, other drugs or drugs names also. Beta blockers. This is one type of the drug medicine, and vasodilators and non-steroidal anti-inflammatory drug. This also has been used for that type of patients, and ACE inhibitors. These are the drugs has been used for those kind of people. And also we have that, yeah, the precautionary measures. CRF. It stands for chronic renal failure. This will be shown that is very significantly that may reduce the non-renal clearance, and also including this, it also alter the bioavailability of the drug. Predominantly, that will be the metabolized by the liver and the intestine. So, living a healthy lifestyle, this can be help to prevent the diabetes and high blood pressure and the kidney. So living in like very healthy lifestyle, so that may prevent all these, means like having a very healthy food, controlling of the rice, so this may control the um some extent it may control. And exercising, these are the basics things to be very healthy. And you have, and the patient has to follow that tips, that may also reduce very lower risk for the kidney disease also, and other problems also. That may be like a very low fat diet. It must contain very low fat diet. And also exercise, I just already told this, because the person, if he exercise, then definitely he'll be very fit. So minimum 30 minutes of exercise. It may be walk, slow jog, just walking also it will, and some basic normal exercise that may also prevents from the patients. And the next question is, explain about the hepatic failure patients. If the patients, for the failure patients. So first let us know what is this hepatic failure. Hepatic failure is nothing but the liver. That liver will is the second largest organ in the body, right? Yes. So the liver is the second largest organ of the body. So that perform many function. I mean the several functions, several different function. So the liver is the second largest organ of the body that performs many several functions. So many several functions, and the liver processes everything, like what you eat and what you drink, and that converts into the energy and the nutrients, that gives an energy. So that converts into the energy and the nutrients of the body to use. And then what is the other feature, that it filters out the harmful substance in the sense it may be the alcohol from the blood. So it just separate, it just filter out, it just take out the unwanted substance, that is like an alcohol from the blood, and helps the body to fight all the infections. That is why, so this is the second largest organ in the body, we used to say, that performs several different function of the body. Yeah. And it exposes to the virus or the harmful chemicals that may very harmful for the liver. So when the liver is damaged, then the patient have to they develop the liver failure. So that is called as hepatic liver failure. In those with the liver damage, the liver may be eventually stop functioning correctly. If it got damaged, definitely it will stop functioning correctly. Some disorders may be obtained. So now the next topic is to mention the types of hepatic failure. So here the liver failure, this can be either acute or the chronic. Acute in the sense I just told you, that is the sickness, serious sickness, illness. Yeah. So let us know acute liver failure. Acute liver failure, this strikes very fast, and the patient experiences loss of liver function within a week or even 8 days. Within the patient experience the loss of liver function within a week or a day. Otherwise, it may be happen suddenly without showing any symptoms. So without showing any symptoms, it might happen suddenly. And the common causes of this acute failure is that include poisoning from mushrooms or drug overdosage. If in the case overdosage of the drug also it might occur, so which can occur from taking too much of the Tylenol. This is about the acute liver failure. Again, I'll just revise it. Acute liver failure, so this is nothing but very fast getting infected. That is the patient that experiences a patient may experiences the loss of the liver function, that may be soon, like within week or within day or suddenly. So that without showing any symptoms, it might occur. And the common cause of the acute liver function, that may include the poisoning from mushroom or the drug overdosage also it might occur. And now this is the next concept, that is a chronic liver failure. This chronic liver failure, this develops very more, it more slowly than the acute. So as it compared to the acute, it will be very slowly, but acute is a very fast. It is develop just within a days, within a week, or just suddenly. But chronic liver failure, it just develop very slowly as compared to the acute liver failure. So that might take a month, not a days, month, or the years before the patient may exhibit any symptoms. It might also develop. And the chronic liver failure, this is often the result of the cirrhosis. This is usually caused by the long-term local usage. If the patient is consuming alcohol for the long term, if the patient is consuming alcohol for the long term, it might occur. So long term alcohol consumption, it might occur. Cirrhosis occurs when the healthy liver tissue is replaced with the scar tissues also, it might occur. And here we have the concept of the causes of the hepatic failure. The causes, let us know the causes of the hepatic failure. The causes. So we have varieties of causes that may be associated with the liver failure. The common causes of the acute liver failure, that is the acute liver failure, that is also known as a fulminant hepatic failure, that might occur if the patient don't have any pre-existing liver diseases, then it might occur. It might occur. And also we have the MC is nothing but the Maho Clinic. Maho Clinic. According to this, the most common cause of the acute liver failure in the United States, that is the acetaminophen, that is Tylenol overdose. Acetaminophen, this is the overdosage, that is OTC, overdosage, over the counter drug. Over the counter drug, it is called as over the counter drug. So now let us know the treatment for this hepatic failure, because this might occur the acute, otherwise the chronic liver failure. So let us know what are the treatments have been there for this disease. Yeah, the treatment in the sense, the treatment depends on the stages also, because all patients are not in the same stage, or they may be differ. So one patient having suffering in starting in the second week, other patient will be in the fourth week. So the same dosage cannot be given for the same person. It's completely a wrong statement, wrong thing that. So what does the doctor do? The doctor prescribes the medication for the second week of patient who are suffering from the hepatic failure, and the patient who is suffering from the fourth week, that is hepatic failure. So then only the patient has to take only those doses. Otherwise, it may happen. It may cause the overdosage also. That may be also in the case. It may be also effective for the patient, because that is why in the treatment the doctor prescribes the medication. So if only the part of the liver is damaged, surgery may be recommended. So some part of the liver is damaged, then it may be surgery is recommended. That is to remove the damaged part. Why surgery? Just to remove the damaged part. A doctor can also take the imaging test, that also look for the liver, to look for the damage. If the LT liver is damaged, then it can grow. If the damaged liver, if the liver is damaged, then definitely they go for the surgery. If the LT liver is damaged, then they doesn't go for the surgery. There is no need of surgery, because it grow back. If the damage is too severe, if healthy liver is damaged, but in case if it is too damaged, it means it is too severe, so which can sometimes be the case with fast acting acute liver failure, then a liver transplant may be necessary. So here, I mean, in the treatment, the doctors only they has to prescribe the medication. If only some part of the liver is damaged, means the patient can go for the surgery. If the liver is if the healthy liver is damaged, then they won't go for the surgery, because it will grow. No for the surgery, it will grow. If the healthy liver it's just like too much of severe condition, then what happen, sometimes it may happen because of the fast acting acute liver failure. In that case, the patient may go to the liver transplant. When they can go for the liver transplant, means it is too damaged, it is too much of damage. The healthier liver is got damage, means they can go directly for the transplant. Surgery means it's just in damage. Healthy liver means it will grow, they just leave over. Now the next concept is a prevention of the hepatic failure. Yeah. So how can the patient they can prevent is, so one of the easiest way to prevent this liver failure is to moderate in the drinking, to see in the drinking. There is the Maho Clinic. The Maho Clinic is there that recommends the healthier women that limit their alcohol consumption to to one drink per day only. That is the alcohol. What does it say, Maho Clinic? They say for the healthy woman about the alcohol consumption only for one drink per day. And healthy man, what about the healthy man? This is about the healthy woman supposed to drink about one drink per day alcohol. This is about alcohol. And this is the woman. I'm talking about the woman, healthy woman, and now healthy man. Okay, healthy men. So age healthy men. This is 56, 55 age. There should be limitation. This is will be the limitation. Their alcohol consumption to one drink a day. Same thing. So one drink per day. So one drink per day. The men under 65, if under 65, should not consume any alcohol. No drinks. Should not consume any alcohol. This is the precaution or the prevention measures for the hepatic failure. Otherwise, the patient may affect the hepatic failure. these are the prevention, and also we have other prevention things also. It's not engaging in the drugs use or the needle sharing, no needle sharing, and also time to time the patient has to get vaccinated for the hepatitis A and B. So get vaccinated. So vaccines are used to treat or to cure the disease, treat or to cure the disease, and protecting the skin from the toxic chemicals. There are huge chemicals will be there, so it's completely protecting the skin from the toxic chemicals. And using aerial spray. Why aerial spray? That can cancel the ventilated area, so that don't inhale the so the patient don't inhale the fumes. So that is why. Yes. So these are the some of the prevention things of the disease. So that's completed the 14th chapter. Once again, I'll just tell you from the beginning. I'll just brief you up. So under this chapter, we just discussed about the drug usage and the precautions. So that precautions when the patient is suffering from the renal failure disease or the hepatic failure, only those patients they has to use some precautions to get rid of this renal failure, and also the drug usage of this of this renal failure we have discussed. Yeah. So under that, we just know about the what is a drug. Drug is nothing but the medicine. The treat for the treatment, and precaution means that there will be some precondition. The patient has to go through the precondition. They has to consume the tablet with the doctor prescription. And some includes like antihistamines that's like allergy of the drug, and sickness and drug and sleep aids. And we discussed about the renal failure, but the treatment and the precaution. Precaution and the treatment. The treatment in the sense that is dyslexia, and precautions means and some drugs also we discussed. Precautions also we discuss. Precautions is in the sense be healthy, to exercise, or these kind of things we just noted on. Decrease high blood pressure, and hepatitic failure patients what they has to do. Hepatitic failure, if this because this liver is the second largest organ of the body, and it takes care of all the functions of the body, and what you like what the patient eat, drink, everything it converts into the energy and the nutrients from the body to get use. And also it just filters out the harmful substances as a alcohol from the blood itself, and helps the body to fight off the infection. That's how it functions. That is the liver. And also we know about the types of this. Types is acute liver failure and the chronic liver failure. Acute in the sense we discuss it includes like the drug like overdosage and sickness and these type of things. And chronic liver is the it's a very slow process as compared to the active. Active is very fast. It may be in the month, a few months, few days, not month, few days, but here it months. In chronic liver it is a month. Means it may be in a 1 month it can occur. And also we discuss about the causes of this hepatitis. This may cause due to the according to the Mayo Clinic, we just saw it may be cause of acute liver failure, that is the United States, for the overdosage of the drug. This may cause due to the overdosage of the drug. Hepatic failure, and we discuss about hepatic failure. Hepatic failure in the sense here mm, if only part of the liver is damaged, then they has to go for the surgery. And if healthy liver is damaged, no need of a surgery. It can be grow easily. If it is too damaged, then there has to go to the liver transplant. Yeah, we have discussed this. And also we have discussed about the prevention method for this. That is, we have protection of the skin from the toxic chemicals. Yeah, that's completely the chapter 4th.